Minnesota Project.
The Minnesota Project was an initiative to rebuild higher education in South Korea. It was part of the US government's post-Korean War aid program, which was led by the International Cooperation Administration, ICA. It was so named because the University of Minnesota served as the project's facilitator. The project was originally planned for 3 years, but was extended and run for a total of 8 years from 1954 to 1962, and was credited with influencing many changes in Korean higher education. While aid was given to many fields, including agriculture, engineering, veterinary medicine, and public administration, the impact of the Minnesota Project was particularly evident in the field of medicine, which received the largest number of international students and funds. While there were numerous aid programs and diverse projects to rebuild South Korea's educational sector after the Korean War, the Minnesota Project was considered one of the most successful, as it came to mold the shape of South Korean medical education. It is known as the project that successfully introduced modern American education and knowledge to Korea. On the one hand, it sets the stage for a rapid change in healthcare system, education, and technology, from Japanese-style medicine to American-style one. During and immediately after the Korean War, there were many introductions of Western medicine to Korea through the military medical department and other institutions. But the Minnesota Project was unlike any other, as it was a large-scale project with organized training and exchange. The total amount of aid provided to Korea through the Minnesota Project was nearly $10 million, with Korea's matching fund amounting to about $7 million. Approximately $3.5 million were spent on personnel exchange, $3 million on supplies, and more than $3 million on building repairs and renovations. In terms of educational aid, Seoul National University accounted for 46% of the total amount, and 226 Seoul National University faculty members were trained in Minnesota under the exchange program. In addition, 61 advisors were based in Korea to advise on the overall educational system. After Korea's liberation, medical education in Korea was not only well established in terms of educators and environment, partly due to the return of the Japanese who made up the large proportion of the teaching and research workforce, but also because of the way it was taught. Korean medical education was borrowing from Japan, and Japanese medical education was borrowing from the late 19th century and early 20th century's German medical education. German medicine was leading the world at the time, but by the mid-20th century, it was falling behind other countries, including the US. A key problem was that Japanese medical education was predominantly theoretical. Medical education then and now emphasized the balanced approach to the theory and practice. However, in Korea's post-liberation medical education, there were no discussions, seminars, experiments, or labs. Instead, it was a top-down with professors reading from a lectern or writing on a blackboard, and students copying what they read into their notebook, a didactic learning. It was a far from the American idea that medicine cannot be taught, but only can be learned. The outbreak of the Korean War interrupted the normal operation of medical school. And it was not until September 1953 that the university returned to Seoul after operating a temporary wartime university in Busan. Upon its return, the university was understaffed due to the death and abduction of faculty members, and facilities and equipment has been destroyed or captured. Rebuilding the institution had to start from scratch.
New generation of medical personnel.
As you can see, exchange program was at the heart of the Minnesota project. In the case of Seoul National University, 77 faculty members were trained in Minnesota over a period of 7 years. And 11 advisors were stationed there, not only to advise, but also to teach students. This led to many changes in the appearance of the hospital and campus in 1959 and 1960, as various hospital facilities were renovated and modern equipment was introduced. In addition, the faculty members who returned from their training are credited with introducing and passing on their newly found knowledge. Research and experience at the University of Minnesota to students, influencing the way they were taught. The faculty established new educational systems, such as bedside teaching, new exam system, clinical clerkship, intern resident system, seminars, conferences, and congresses that required participation of the students, and spread the American way of medical education throughout the nation. This also led to the adjustment of nursing training from high school to university and the establishment of graduate school of health. One reason for this extensive change was that many of the Korean personnel sent to the United States were young professors or graduate students, and this was intentional. The idea was that by exposing the younger workforce to American medicine early on, they would be able to create a new wave. When they returned to Korea, they would be able to hold stable position for a longer period of time, embedding the new teaching methods and culture. Of course, there was also a component of sending senior professors at the dean level to understand the American medical education system in general. But 72% were junior educators who were still in the process of completing their degrees. The Minnesota program also provided them with the opportunity to pursue a master's or doctoral degree in the United States. In them, 8 earned the master's degree in the US and 3 earned the doctorate. The University of Minnesota sent a total of 11 advisors, 7 in medicine, 3 in nursing, and 1 in hospital administration. These advisors managed the day-to-day activities of the projects by conducting surveys, attending meetings, and making recommendations. But they also made personal connections. They offered advice in their areas of expertise, taught students directly, and provided career counseling. Some of the students who later went on to study in US outside of the Minnesota project attributed their English language learning and career aspirations to their conversation with these advisors. The advisors saw their true roles as supporting, inspiring, and motivating Korean educators and students. Also, some of the advisors who worked in Korea for extended period of time went on to work as professionals in the field of international cooperation after returning to the US. In other words, their experience in Korea were life-changing for them. They also served as advisor to several aid projects that were successors to the Minnesota project, offering their professional perspectives on the medical education in Korea and contributing to the development of a good working relationship with Korea.
Limits of the aid.
How can we evaluate the Minnesota project? Why was it successful? And what lessons can we learn about the international cooperation from it? The fact that the project was planned to have long-term impact on society by sending young people was probably one of the key success factors. However, the fact that many of the doctors returned to Korea to continue their medical practice after the project ended may have been due to the sense of responsibility. But it may also have been due to the immigration policy of the United States at the time, which strongly restricted the entry of foreigners into the country. In this way, A number of social factors determine the success and limitation of the Minnesota projects. On the other hand, political and ideological reasons may also have been one of the factors that led to the active acceptance of American-style medical education through the Minnesota project. Seoul National University, especially the medical school, based its physical and human resources on those of the former Keijo Imperial University. And many of its early educators were graduates of the Keijo Imperial University. As a result, Seoul National University's medical school partially inherited the colonial legacy, but was forced to deny its continuity in a liberated space, Americanizing it by actively adopting advanced American medical technology and teaching method would have been an effective way to erase this continuity. The Minnesota project was one clue to the process of reconstruction of Korean society through aid. At the same time, it showed that there were multiple efforts to capture social resource and status through new American interests during the process of decolonization. During this process, Korean society experienced another current of Americanization. Moreover, while these aid programs led to the development of Korean society, they also led to the unequal distribution of resources. The concentration of resources centered around Seoul National University has been evident since this time. On the one hand, we can think of the hierarchy of university and the unequal distribution of educational resources between Seoul and the rest of the country, which still is an issue in Korean society. On the other hand, the improvement in the quality of education created the opportunity to produce a large number of highly qualified human resources in a short period of time, which was a positive impact of aid. However, this also had a dual effect of sending these workers back to the US through brain drain, exacerbating the shortage of healthcare workers in Korea.